Good morning, Dr. Hadeli here, and I'm so happy to see you. Um, Today, I'm going to be talking a little bit about fever and fever management in infants. And something very important, I always have to give my disclaimer that I'm not here to substitute your doctor, and everything I talk here is for educational purposes only. And if you have a concern or you feel that your baby needs to go to the emergency, please feel take your baby to the emergency, okay? I'm gonna give you a little bit of education about what fever is and how to manage fever, okay? Uh, to start with, it's important to measure the temperature because many times I had the case where parents come to me and they said, oh, baby has fever, but they didn't measure the temperature or they don't really know what fever is. To start with, fever is defined as a temperature more than 38 centigrade C, okay, or centigrade, and or 100.4 Fahrenheit, okay. That is fever, more than that. In babies, in little ones, you can start by taking the temperature axillary, but if you are not sure about the temperature, you're worried, you want to double check, or mostly newborns, you can actually check it rectally. Rectally, that's very accurate because it gives you the core temperature. Axillary, you have to add 1 degree, okay, to the temperature. For example, it was 99, so really baby is 100. Baby was 90, 97. Maybe it was 98. But one more thing, and this is also important, is that in newborns mostly, low temperature is as bad or sometimes even worse than fever in newborns, only in newborns, okay? So if a newborn has a temperature lower than 95, that could be something very serious because that could mean baby has an infection, okay? But that's a different topic right now. I'm focusing on fever. And something I want to mention is the main question I get is like, what really helps? What should I do? And when should I give medications? So to start with, what really helps for fever, and this is based on evidence, fever reducing medications, okay? But there's a specific age for certain medications, okay? Undressing your baby, because bundling up too much your baby is not good for the fever. It's like if you warm up something in the microwave and you just cover it, you are just trying to keep it warm or hot. For babies, same. If you are bundling up too much your baby, then you're making that the temperature stays in your baby's body. So pain reducer helps undressing, not over bundling babies. Cool compresses, important. Cool, no cold. Okay, cool compresses. They could be like in forehead, a little bit here, shoulders. Cool, no cold. I'll mention why in a little bit in time. Okay. But something very important, any newborn or any infant younger than 3 months with fever, you have to go to the emergency no matter what. Before you even attempt to give a medication, you can start by uncovering your baby, but you have to go to the doctor. Why? Because mostly under a month they are more prone to something called sepsis, that is where bacteria or viruses or any infection can easily go to the bloodstream, but also can go to the fluid that covers the brain, and then that could give something called sepsis or meningitis. You don't wanna uncover that. So any baby under 3 months, a month is critical, but 3 months, from 1 month to 3 months, is called gray period. So any baby under 3 months, before you attempt to give something for the fever and mask up something that could be more serious, you have to go to the doctor. Okay, important. Other than that, acetaminophen is approved after 3 months. Sometimes it's given earlier in certain circumstances, but that has to be directed by your doctor. But acetaminophen or Tylenol, which is the same, is approved after 3 months. Ibuprofen is approved after 6 months, so don't give ibuprofen to a baby younger than 6 months, please. Okay. The other thing is, other things that might help to lower the fever are lukewarm bath. Also, hydration. This is key. Hydration. When babies have fever, they start getting dehydrated. So hydration is important to lower the temperature, okay? But hydration itself won't do it. So that's why many times in older kids we need to give something to control the a medication to control the fever, because when they have fever they have pain, they don't feel good, they have malaise, they have body aches, they have headaches, and then they don't want to drink either. So you want to like have a balance there, control that discomfort, and keep baby hydrated or infant hydrated. The other thing is, this is important, things that won't or don't help to lower the fever at all are a lot of blankets, so don't bundle up too much. Cold bath, this is important. Why? Because our body is like a thermostat, and our body feel if you try to lower the fever too quickly with something cold. Remember, cool is okay, but cold, no. If you try to bring the fever down too quickly with something cold, what happens is that temporarily you bring it down, but then the thermostat of the body try to go up, and then your baby is gonna have a rebound higher fever. So that is not good. You will bring it down from 39 to 37 very quick, and then baby, like an hour later, is gonna be 40 or more. So be careful. So not too fast. So no cold, no bath on ice. Avoid that. No aspirin. Aspirin is definitely a no for any kid under 18, and the reason why is because aspirin is highly associated with a condition called Reye syndrome that can give many complications in infants, and anybody under 18. Okay. And no alcohol bath, those don't work. Okay, I already mentioned what is approved by the AAP and the FDA. Okay, as I said, acetaminophen, ibuprofen. But something very important, if you decide to do either one of you have to be aware and be very careful that the dose varies based on the weight and the age of your baby. Okay, so this is important. Also, you have to be aware that Tylenol or acetaminophen, which is the same, can be given every 4 to 6 hours. But ibuprofen or Motrin, which is the same, can be given as often as every 6 to 8 hours. You don't want to give ibuprofen or Motrin sooner than every 6 hours, okay? Because that could give complications too, okay? So this is important, and ideally measure with a syringe. So you give the right amount based on the weight and the age, okay? So this is very important, and I just want to make sure and to just give you the final recommendations. Is important that if you feel that your baby is having fever but also having difficulty breathing, you have to go to the emergency or to the doctor right away. If you feel that your baby has fever but is also very lethargic, not waking up, has decreased with diapers, you have to go to the doctor, to the emergency right away. If baby has fever and it has a rash that is coming very quickly, a rash that is spreading or looks purplish, you have to go to the doctor right away. Or any baby under 3 months old, you want to go to the doctor or the emergency, because those babies might need blood work. Under a month, definitely fever equals blood work admission, because we need to do a sepsis workup, okay? Depending on other symptoms, that can be broad or can be partial. Of course, I'm not here to talk about medical stuff, But please keep that in mind and feel free to ask me any question. I'm more than happy to help you with any questions you might have. If there's also a topic that you're interested on and you want to learn more about, I'm more than happy to talk about that too, okay? So have a nice day and take care. Thank you for being part of my community.